today I'm going to share you some information about Parkinson's disease. So what is Parkinson's disease? It's a neurodegenerative disorder and a progressive disorder of CNS which includes motor and non-motor symptoms. There are four cardinal signs of Parkinson's disease. Motor symptoms which includes rigidity, bradykinesia. Rigidity means stiffness of muscle which includes of arm and legs. Bradykinesia means slow movements. Tremor, shakiness in doing any kind of activities or holding objects, and postural instability, that is loss of balance and coordination. Non-motor includes loss of smell, loss of taste, rapid eye movement, sleep behavior disorder, and orthostatic hypotension. Which orthostatic hypotension means your BP drops down suddenly when you try and get up from a seated position. So now moving to anatomy and physiology of Parkinson's disease. So there are nerve cells in the substantia nigra that produces neurotransmitter known as dopamine, and which are responsible for relaying messages to have a control body movements. And in Parkinson's disease, this affects nerve cells in the deep parts of basal ganglia. Deep parts of brain known as basal ganglia and substantia nigra. This disease occurs when dopamine producing neurons in the brain responsible for body movements are dying, which leads to decreased level of dopamine levels. And now moving to physiology part of Parkinson's disease. That in Parkinson's disease, PD symptoms like tremor and stiffness occurs when nerve cells fire and there is not enough dopamine to transmit these messages and to have a controlled movement. Now moving to physical limitations. So what are the physical limitations occurring in Parkinson's disease? As we have seen, there are motor symptoms and non-motor symptoms. In motor symptoms, like there is walking inability, gait pattern is disturbed due to postural instability, that is due to balance and incoordination of that. Imbalance and incoordination, tremors and shaking, which can make it difficult for the Parkinson patients to hold the objects and to have a controlled movement. Grip strength are reduced, and safety considerations in Parkinson patients is like that they face many physical limitations. They cannot perform as a normal individual. So there should be home safety, like the environment of their home should be spacious and wide, so they can have their room for any daily activities. So and physical therapy can help in counseling and improve their confidence, and it helps with PD, developing safe and effective exercise program, and learning strategies to cope up with daily activities. Mobility aids, it helps them to with balance and with mobility, and caregiver support, it can play an important role in helping people with dementia with Parkinson's disease. Also in gait training, Parkinson's patients have, like, there is very narrow base of support, and the fall of risk is high in that, so they have constant fear of falling. So this all counseling it helps Parkinson's patients. So now moving to exercise part. So I have taken two exercises, aerobic exercise and strength training. Aerobic exercise, it helps to improve their cardiovascular endurance and their overall health, and slowing down the progression of the disease and easing up the symptoms. And strength training, it helps to build up their muscle mass and making their day-to-day activities easy with easiness. So now, first of all, I'll start with strength training. So I'll show you bicep curls. So in that, Parkinson patients, they cannot have their movement, rapid movement. So to have a control movement, just take the weight as much as they can lift and just contract and relax your muscle, bicep muscle. And this exercise should be repeated for 10 to 15 times of 1 to 3 sets. And this type of exercise is strength training, 30 to 40 minutes. Tricep extension, just extend your elbow and keeping the hands straight. Strength training can be helpful in one or bulk of like group muscle as well. Now moving to wall squats. That this exercise is helpful in lower body strengthening. Just take the support of the wall. Take the support of the wall, and as you are sitting down from a chair, this can be modified. You can also modify this from sitting up and getting up from a chair. Etiology of Parkinson is unknown. The symptoms can be relieved. The treatment of the disease has not been yet discovered. Now moving to cardio training. So every 15 to 10 minutes of walk is advised, and cycling as well. If they incorporate these exercises in their daily activities, so this will help improve their better quality of life. Thank you.